Digital infrared thermal imaging is a highly sensitive and non-invasive clinical imaging procedure that emits no radiation of any kind for objectively detecting and monitoring many injuries and conditions. The color scale for visual interpretation is based on a 16-color scale that is divided into an 8 degrees Celsius range, which gives half a degree per color for visual interpretation. The human body is thermally symmetrical, and the images shown are normal thermal patterns that are constant and repeatable. Thermal imaging is especially appropriate for younger women between 30 and 50, whose denser breast tissue makes it more difficult for mammography to detect suspicious lesions. This test can provide a clinical marker to the doctor that a specific area of the breast needs particularly close examination. Digital infrared thermal imaging detects the subtle physiologic changes that accompany breast pathology, whether it is cancer, fibrocystic disease, an infection, or a vascular disease. Doctors can then plan accordingly and lay out a careful program to further diagnose and/or monitor until other standard testing becomes positive. This allows for the earliest possible treatment. The image here shows a 37-year-old patient presented for routine thermographic breast screening. She was not in a high-risk category. The vascular asymmetry in the upper left breast and the local hypothermia at 11 o'clock was particularly suspicious, and subsequent clinical investigation indicated a palpable mass at the position indicated. A biopsy was performed and a DCIS of 2 centimeters was diagnosed. Detection and monitoring of all cancers with digital infrared thermal imaging relies on the body's sympathetic response to the pathology. TMJ can be difficult to diagnose. This patient had classic symptoms and classic thermographic findings consistent with TMJ, which helps to confirm a diagnosis. The frontal view of the upper legs shows a patient who had unexplained pain in the right leg for over a year. The thermogram shows a varicose vein that a vascular surgeon was able to treat with minimal intervention due to the accuracy of the localization. The image showing the vascular pattern in the right lateral leg was a patient who had a 3-year history of pain in the mid-lateral thigh and knee. After a series of tests failing to find any cause for the pain, this thermographic study led to a confirmed diagnosis of phlebitis. Hyperthermia over both lobes of the thyroid indicated this patient having thyroid dysfunction. This football player's X-ray showed no abnormality. Thermography correlated well with the patient's report of pain and provided justification for the more invasive test, which clearly showed a stress fracture in the exact location indicated by the thermograms. Very objective monitoring of the effects of treatment can be recorded. In this comparative study of over 30 minutes, a significant change in the temperature differentials in the medial left leg is due to acupuncture treatment. The entire region of interest is seen to cool, but the local area of inflammation in the medial knee changes and reduces at a much greater rate.
Thermal imaging systems are designed for mapping and measuring surface temperatures. The camera is sensitive to infrared radiation rather than visible light.
The patient is asked to disrobe and put on a lightweight gown. This allows for the body to acclimate to the ambient temperature of the clinic before imaging begins. The technician will then focus the camera and start the scan. She can adjust the display, compare images, and change color maps for the interpreting physician to better see the necessary colors for evaluation. The colors in a thermogram are applied to ranges of temperature. The colors are applied to identify patterns which are more important than the colors. The colors in a thermogram are applied to ranges of temperature. These colors are applied to identify patterns which are more important than the colors. These colors show a temperature range of 8 degrees Celsius over the body. The technician's objective is to constantly provide optimum quality images. To maintain this standard, it is important to adjust the images so that the area of interest is within the middle range of the color scale. For more information, or to set up an appointment at Dr. Mercola's Thermography Diagnostics Center, please contact Ella Obara at 847-252-4311.